Dr. Callender, it is great to see you again. Thank you so much for joining us today. I'm honored to, be the host today with you to talk about community, to talk about your background, your passion and purpose for driving organ donation and transplantation, and disparities just generally. So it's really good to see you. Welcome.
Thank you for the opportunity to share my opinions.
Absolutely. Happy to have you here. So, thought we could start with just background for the audience. Many of those who may have not had the pleasure of meeting you, from one public school boy to another here from New York City. Just tell us a little bit about your background, how you became a transplant surgeon, what inspired you to enter the field.
What you just asked me could be an hour program.
That's all right.
I'll cut it down to a sentence or two. Since I was born in about 125th Street, New York City, and did all my education in the public schools of New York City. So after finishing Hunter College, I went to Meharry Medical College in Nashville, Tennessee. And it had been my lifelong dream to be a medical missionary since the age of 7. And so I was blessed, and this was an opportunity to go to Meharry and get my medical degree. That was in 1959, 1963. I finished as the #1 ranking student in the College of Medicine, but also got the opportunity to do further training in surgery to help make my dream of becoming a medical missionary come true. So after I finished my training at Howard University in surgery, I got the opportunity to have my life dream come true and go to Nigeria to spend time as a medical missionary and as a surgeon. And it was there that after 9 months, I'd lost 50 pounds, came back to the United States, and thought that I would like to give it a second chance. And so later on, I went back for 3 months and lost 20 pounds. And so this said to me that maybe my lifelong dream of being a medical missionary would be a short-lived one, and that maybe I should come back to the United States and spend my time here. And so with that in mind, I took a transplant fellowship at the University of Minnesota. And so I came back in 1973 and started the transplant program at Howard University. And was there that I recognized and realized that we needed organs desperately, but we were really, people of color were really donors. And so I then began an effort to try to make a difference. At that time, nobody thought that Blacks would donate. Blacks were really donors, and many felt they would not be donors. I felt that growing up in the churches in New York City, being a very religious man myself, that this is an opportunity to go back to the churches and shed light on the subject. And so beginning in actually in 1980, we started a program to go into the churches, go into the community, educate and empower the community to become part of the solution to the problem. So this is how it all got started, since that's a long answer to your short question.
No. Well, thank you for answering your calling, and we're all better for it, and our community is better for it. And, I know you've done a lot of work with founding the National Minority Organ Tissue Transplant education program, and you just touched on some of that, but, your passion for educating the community has been pretty critical. One thing that I think we all know is that there's a lot of myths and misconceptions out there with our community and in the public. I'm sure you've had to educate a lot and dispel those. Can you talk to our audience about that a little bit today and help us understand?
Sure. I guess and this is one of the reasons why I felt that we start off with the churches, because the first myth and obstacle was that people were not aware that people of color are disproportionately afflicted and affected by high blood pressure and diabetes. And therefore, we need organs more than any other ethnic group. And so there was a lack of awareness of this. Second, there was a lot of religious misperceptions relative to the role that religion plays in organ donation. Forgetting that there is no religious obstruction to donation. Christ came, died, and gave his life to save others. And so donating is just in line with Christianity and with most religions. And so that it is the right and proper thing to do. The misconception was that if I leave my organs behind, I won't be able to see great-grandmama in the hereafter, or I won't be able to hear. Forgetting that it's a new resurrection, a new life, a new body. And this old body is no good anymore. And so this was the second myth that we had to dispel. The third had to do with the basic distrust of the health science community because of the way they had mistreated and abused people of color by misusing research. And so we had to restore that trust in the healthcare provider, and we did so by having more people of color in positions of leadership in the healthcare community. The fourth had to do with the fear of premature declaration of death. If I go to the hospital, they're getting my organs and tissues, and we're saving my life. And so we had to overcome that by having laws and other things that made it impossible for you to do anything about somebody before they died. And then the last issue, and one of the biggest that I've had to overcome, is the issue of racism, institutionalized systemic racism. And this too required us to get community education and empowerment to overcome all 5 of these misconceptions and barriers to trust.
That's great, Dr. Callender, and such a wealth of knowledge. You'll be happy to know we're making a lot of progress here in New York, and I'll share some more with you later. But if you had one wish, and you got your medical missionary wish, if you had one wish, one thing you could do to change this industry and change the space, what would it do? What would that one thing be that we need?
Well, the one thing that, and I've purposed my goals from this point on, because I've spent a lot of time in the community educating and empowering them and giving them a voice. So at this point, in dealing with institutionalized racism and those barriers, I think going into the middle schools and elementary schools and letting them know that people of color are in the field. Because one of the biggest obstacles is that at the top of the transplant industry, there aren't many Black people or people of color. And so that's one of the things we would need to change. And I think that one of the best ways to change that is by educating our middle school and elementary school level people so they'll know that this is an area that they can be involved in. This is an area they can make a difference.
We agree, Dr. Callender. Thank you so much. Once again, just for our audience and the people listening, this is such critical knowledge and information you've shared, and thank you for everything you've done for the industry and the community to make it better. We'll get better and better thanks to people like you.
You're welcome, and it's a pleasure to have the opportunity to meet you and to talk with you and your audience.
You as well. Have a great day.
You too.
Thank you.